Okay, so Assalamu alaikum everyone. I hope you all are doing well. I'm Hania, a third year medical student at Lahore Medical and Dental College. Today, I'm one of your moderators alongside Amna.
Assalamu alaikum everyone. I hope you're all doing well. I'm Amna, a first year medical student at Lahore Medical and Dental College.
Welcome to the free USMLE Webinar Series by Ravish.
These webinars aim to provide comprehensive guidance on the United States medical licensing examination journey. Today's webinar is on OET. We'll cover the study resources, methods involved, test day tips, time management, and much more. Before we dive in, I'd like to give special recognition to Zohaib Ahmed, President of Ravish's local cabinet at Ameer-ud-Din Medical College, Postgraduate Medical Institute, whose efforts made this webinar possible.
I would also want to briefly introduce Ravish, an initiative led by final year MBBS students from Lahore Medical and Dental College. We are a student run organization active in 18 medical colleges across Pakistan. Ravish has hosted various medical camps, ration drives, school renovation projects, and other social initiatives to support underserved communities in Punjab, and with plans to expand to other provinces soon. In addition, we are also working on human development initiatives, including student education and other social cultural activities. This is it about Ravish. Moving forward, we are honored to have an incredible panel of speakers with us today who will provide valuable insights to help you with OET. First, we have Dr. Osama Ahmed, MD, a graduate of Shifa College of Medicine. He will be sharing insights on study resources, methods, and practice tests. Over to you, Dr. Osama.
Thank you, Hanya. Thank you so much for having me. I'm I'm very pleased to be here today. Just wanted to run a quick sound check if I'm audible to everyone.
Yes, sir, you are audible to us.
Okay, that's great. So, the second, I'm just going to start sharing my screen so that everybody can see it. Okay, here we go. Mhm. Okay, so before we go ahead with this OET, um, I just want to, trying to judge okay, where do we all stand. Like most of you should know okay, before OET wasn't a thing like till up to 2 3 years ago. So pehle, we used to have step 2 CS and that got replaced during COVID. So ever since then we have just switched to OET to make up for CS. So with that, okay, so what is OET? OET is basically an international English language test. It's basically just आप पहले TOEFL देते थे और IELTS देते हैं. So for all your US, purposes, you need to use OET. OET is acceptable not just for US, it's also acceptable for England and Australia as well. So, and the best thing about this is it's not, a very diverse. It's a very specific test, which is catered and which caters to us as doctors, so that we get an advantage in that. Okay, we don't really have to prepare for any kind of scenario. We just all the scenarios we encounter, be it in the writing or in the listening or anything, that's all very focused towards medicine and how we practice in our daily lives. So to begin with the study material, right? So I think the number one best resource for OET is the OET website itself. They have a number of free tests available for each sub test. Like चाहे आप listening का करना चाह रहे हो, writing का करना चाह रहे हो, जिस चीज़ की मैं practice करना चाह रहे हो, they have around 4 to 5 tests for each of those categories there. And there are also a few books available in the local market because OET के sample tests they sell them officially online, but there are a few books available in local markets where you can get them. But I really don't think they're very necessary because the main चीज़ आपको practice करनी होती है that's listening, and that's mainly for online resources. So moving forward, we'll go to the various online resources we have. Online I think YouTube is a great help. YouTube page, you'll find a lot of channels who are like proclaiming they can help you practice well, but I would suggest just sticking to a few which are like time and tested. Because once you start going through those other resources, you realize they're not that high quality. They're wasting a lot of time of yours, and but animated, scripted चीजें वो आपको सिखाते हैं. That's not really how you need to practice for your OET. So the one of the few resources we found really good, like me and my colleagues, was one is OET Online. That's a channel on YouTube, and another is E2 Language. They both have really short, comprehensive videos which cover topics. I think we have a hand raised. Somebody wants to ask something. Okay, so yeah, so E2 language and OET online, they both have really short, comprehensive videos which are very specifically. So you can सबसे पहले तो आप जाके देखो ना कि like intro to OET. This is the what session we are having right now that would cover in subkey the intro to OET wali videos. But then you should get accustomed to the format and everything. We're gonna cover everything. The other speakers and I will cover those things as well. But I would recommend कि आप एक दफा बेशक वहाँ से भी जाके देख लो, so that in case any of us misses something, you can just get onto it quickly, because the main thing about OET is understanding its format and trying to get yourself accustomed to what they're asking you. It's not a difficult exam. None of you're all doctors, mashallah, sorry, like logo, you've made it this far in life, so this is not going to stop you moving forward. तो इस चीज का बिल्कुल नहीं आपने परेशान होना. Okay, so for study methods, now this is like a very individual, subjective thing. Some people dedicate weeks to it. Some people just give it a few days, and some people just decide to show up. I would not recommend being on either end of the spectrum. Don't just show up unprepared. That's also wrong. Don't spend months preparing for it. You need to spend months for your step one, step two. Like in iskali, you shouldn't be spending months. I would say a comfortable time period is anywhere between 2 to 3 weeks, and this 2 to 3 weeks could be, if you're good at managing your time, you spare like 2 to 3 hours a day. So अगर आप dedicated 2 to 3 hours लगा रहे हैं, so that's good enough if you can consistently work over it for 2 to 3 weeks. Okay, so as we'll go through the format of the test, आगे भी तो the main four parts of the test. एक listening होता है, reading, and then writing and speaking. This is actually the order in which you will be giving your exam on the exam day as well. सबसे पहले आपका listening section आता है, then the reading and writing and so on. So with these things, if you really want to go out of the box and practice more, for listening, you could just put on some कोई भी जैसे आप यूट्यूब पे पेशेंट इंटरेक्शन वीडियोस होती हैं, हेल्थ केयर पॉडकास्ट स्पॉटिफाई पर आपको मिल जाएंगी. Try listening to those, and the main thing about listening is trying to get yourself accustomed to a variety of accents. Most of the media we consume, that's usually American, right? So we are very used to listening to American accents, which is like one of the most simple ones to understand. तो थोड़ा सा जब British accent या Australian accent आ जाता है, that's where things can get a little tricky. They're not hard, but just need to develop an ear to catch on to those things. Reading, most of you will be fine. Writing, maybe writing, the one big tip I got is like the one hindrance I had initially in my first practice test and then the second one, because up एक practice test करते हो and then you realize they have also a sample answer for that, and then you compare your answer with their answer, and that's when you realize कि यार अच्छा चलो I could have done this way, and then you do it that way in your second practice test, and उनका जो sample answer होता है for the second test, that's totally different, and then you get frustrated कि भाई I was doing everything they told me and I still didn't get the right answer. But that's where you need to realize that there is no single one correct answer. Anything you do will be correct as long as you get your grammar right, you get your punctuation right, you get your spellings right. These things are what's most important. Skill up, of course, there's a slight scale कि आपने कौन सी चीजें include करनी है, कौन सी चीजें exclude करनी है. They give you the details, they give you the entire thing. और उसमें से आपने basically it's like a summary writing. क्योंकि आपने बस फजूल चीजें निकाल देनी है, काम की चीजें रखनी है. And speaking again is a very polite and interesting part of the exam, क्योंकि it just flows naturally. वो जो आपके सामने जो proctor बैठा होता है, चाहे आप online कर रहे हो या आप in person कर रहे हो, they make you, it's a very natural conversation that flows. So I would say इसके लिए भी you guys don't need to worry a lot. You should practice, and we'll get to there how you should practice for that. Okay, so like we talked about this 2 to 3 weeks, and if you can spend like 2 to 3 hours per day, so that's great. Up एक दफा do an entire practice test and mark the areas you're weak in. चाहे आप listening में मसला आ रहा है, writing में आ रहा है, because that's the main area you need to spend most time on. आप बार हर area जिसमें आप पहले आप you're getting 95%, yeah, जो भी उसमें था, you're getting like a top score band in that. तो 42 में से अगर आपका 42 40s में आ रहा है, तो you don't really need to practice that again and again. You need to move on to the other section. ठीक है? Listening में जिस तरह we talked about just listen to medical consults, good updates, and the main thing is when you're listening, you need to pick up the main information, क्योंकि वो बात घुमा के आती है. वो इस तरह होता है कि वो पूछेगा आपसे दर्द हो रहा है, तो you'll be like, oh yeah, I've been in so much pain, my arms been hurting, and you will be like, okay, उसका बाजू में दर्द है, and then they'll be like, my arms been hurting, and when I woke up this morning I had pain in the center of my chest, and now it just feels right. under my collar area. So the answer is going to be there. Okay, the pain is right in the collar area, not in the arm. So you just need to pick up the right detail, because उसने बाजू के जो शुरू में description दी, that's just a way, how when we're talking, we're not very to the point. Bullet points में तो नहीं बात करते ना. We all talk in a very natural conversation manner. So जो listening होती है, that's actually the conversation between a doctor and a patient. So you need to pick up वो, and like I said, accents वाली बात पे है. Reading, maybe it's if you really want to practice more, you should read medical articles, research papers, because this can get a little tricky in a sense. Okay, it's more of a formal writing, so things can, there are a few questions which require reading between the lines, so you can't really take things at their face value. So you need to understand what the text is trying to say, and then you need to answer. It's a one-word answer, so वो मसला ये बात नहीं है कि आपको लंबा चौड़ा आंसर नहीं देना होगा. For writing, yeah, just you need to work on understanding कि उनका format क्या है, what they're requiring. Letters ही होते हैं, and they're either a referral from a primary care provider to a specialist, या from a specialist कोई discharge कर रहा होगा patient back into the service of a primary care provider. So these are the things just about these things you pick up once you in a clinical practice as well. क्योंकि देखो, if you're as a PCP, if you're referring somebody to a specialist, you won't be telling them कि भाई ये test करो. That's for the specialist to decide. So if अगर उसके workup में आपके notes में दिए हैं कि ये चीजें हैं, you could, like in the text, you could casually mention कि okay, we are thinking of this, but we recommend we're asking for your advice, and take over this patient's care. And then when you're discharging as a more specialist doctor to a PCP, you will give more details of the follow-up care plan. आपने उसके treatment plan के बारे में इतना कुछ नहीं. अब 6 बंदे हैं, एक patient ICU में रहा है, उसकी details नहीं जरूरी, notes में दी हुई होंगी, but those details are not important for the PCP. More important details are कि a patient को इतने दिन पे mobilize करना है, इसकी ये medication है, उसके ये follow-up करना है, हफ्ते बाद उसका ये test करा लेना है. Those things are more important for the PCP, right? The 5-day stay in the ICU is not that relevant for the PCP anymore. So yeah, you'll pick these things up as we go through. आपको बाकी भी अभी presenters बताएंगे. And for the speaking, of course, speaking or speaking. So practice with another friend who's also giving an exam. Keep changing roles. एक proctor बन जाए, एक examiner, like examinee बने. So that's how you will get the flow of it. And your points, they give you points to speak on again, right? But just don't read out those points. Put them into a conversation. वो आपको एक बात बताएंगे, make a जुमला out of it. आप वो करोगे, it's a very short thing, आपका time पूरा हो जाएगा. And do not worry if you're running out of time. You are not judged on कि आपके points रह गए या points नहीं cover हुए. What you're judged on is कि जो आपने 5 मिनट बोले हैं, सुने हैं, वो आपने सही से सुना है, अगला सवाल क्या पूछ रहा है, और जो आप बोल रहे हैं वो सही से बोल रहे हैं या नहीं. So you don't really need to rush to fill in all the points. Those things are not part of the marking criteria. Practice test. They build your confidence, give you an idea कि आप कहाँ पे हो, and it's really important कि आप online दे रहे हो या paper. I personally gave my exam paper based क्योंकि I was just more comfortable with writing with a paper and pencil compared to doing it online. Like most of my friends give it online. Either way, it's fine. But see, once you're doing the practice test, they have lesser number of practice tests for the online. तो अगर आप online भी दे रहे हो, तो आप offline के practice test करो, or eventually do one or two, दो ही मेरे ख्याल से online के वो भी कर लो, ताकि you get an idea of the layout of the system कि वो क्या tabs किधर हैं, and then just be comfortable. जो आपको, if you're more comfortable writing down like a 200-300 word note बाहर से, if you're fine. If you're not, like less than 30 minutes, you're fine. Yeah, if you're more comfortable typing it out, either way, both things are fine. Score में फर्क नहीं पड़ता, आगे weightage में कोई difference नहीं है. Just choose whichever you're more comfortable with. Okay, practice test. Yeah, OET के official website पे भी है. I'll just go through here. Okay, once you go to the OET website, they have these reading sample tests. You should filter by profession, choose medicine, and it will show you these sample tests for reading या medicine के हिसाब से. Online के भी इसी पे हैं. Online के they just have 2, but इसी तरह reading के, study, writing, हर चीज के हैं. So I think you should just go through those once. Other than that, online resources, maybe we talked about E2 online. English with Emma is also a good resource. Some people have worked on it. Like, I think you should only go for this if you're feeling you feel underprepared after having utilized the other resources. I would not recommend going through because it's more extensive or more time later. It's like going through B&B for steps. Not everybody needs to go through. अगर आप किसी चीज में you feel like you're lagging in some area, you should go for it. Then that's great. Then. Okay. Another thing is, okay, there's only like 4 tests, so you run out of 4 tests in like 16 hours. 16 hours, that's it. अगर आपने सिर्फ OET के online work करना है. What we're doing here is I'm sharing this link. This was shared by seniors of mine. This is a Google Drive link, which has a lot of dedicated OET के पुराने papers और वो चीजें हैं. So they're divided into folders for listening, reading, speaking, and writing. आप जो भी choose करो, just go through it. It has mock tests and everything in it, so that would be helpful. We'll have this link shared with you guys in the chats. Yeah, बाद में जब भी थी. If you want to take a screenshot, you can go ahead and take a screenshot of this as well. Yeah. Okay. Like that really does bring me to the end of it. And one thing I would just like go back and say, okay, once you write your essay or the note, just put it in Chat GPT and just give it a prompt to rate this letter on a scale of 1 to 100. What it does is it tells you कि आपका मसला क्या था. अगर यहाँ पे just ask it to comment on your grammar. Don't ask it to rephrase it. Don't ask it to rewrite it or anything. आप बस उससे बोलो कि भाई इसको रेट करो, मेरी ग्रामर का मुझे बताओ, क्योंकि आपने जुमले रटने नहीं है यहाँ से. All you need to do is like just see how simple it is. Right? This is a referral writer. I think this is the first one I wrote. Yeah. So the first one I wrote, it's like simply, thank you for seeing this guy who's this who requires an urgent investigation. इनका जो format है वो यही है. Basically, you need to tell them in the first line कि patient कौन है and why you're sending them. So I've done that, I think, fairly well. Told the referring physician कि भाई my patient is this, ये है और उसको ये है. Give a brief history because see, I'm a PCP, so I need to know the history well. जो थोड़े को lab works की वो की है, and now I'm just giving them a little social history, and then just thank them, and I'm referring them for endoscopy, and बस वो prompt आपको देते हैं, सारी detail आपको देते हैं. You just need to put it into words and leave out the unnecessary things. Yeah, I think that's it from my side. If you guys want to take over, if you have any questions for me specifically right now, I would be happy to answer those as well.
Thank you, Dr. Sama, for sharing your comprehensive insights. They are beneficial for students while preparing for OET. Next, we have Dr. Zainul Abidin, a graduate of Ameer-ud-Din Medical College, who will be briefing us about test day tips, time management, and exam format regarding the reading and writing part of the OET exam.
Assalamu alaikum. मेरी आवाज आ रही है?
Yes.
जी, मेरा नाम डॉक्टर ज़ैनुल आबिदीन है. मैं अमीरुद्दीन मेडिकल कॉलेज से ग्रेजुएट हूँ और लाहौर जनरल हॉस्पिटल मेडिकल यूनिट 3 में इस वक्त हाउस जॉब कर रहा हूँ. मैंने स्टेप 1 और स्टेप 2 क्लियर कर लिया हुआ है और रिसेंटली अगस्त में मैंने OET पास किया है. तो मेरे हिस्से में ये कुछ टॉपिक्स आए हैं जो कि जनरस प्रेपरेटर्स जो इस सेशन के उन्होंने मुझे दिए हैं. आई एम वेरी थैंकफुल टू देम फॉर गिविंग मी दिस अपॉर्चुनिटी टू एड्रेस दिस ऑडियंस. So let's get started with this. So first I'm gonna go through with is the test day tips. So test day tips for me, the do's are arrive at least 30 minutes early. The test is most likely gonna start at about 9 o'clock, but they're gonna mention you in the email. They're gonna send to you that please do arrive at least 8 o'clock or 7:30, so that the check-in process goes in smoothly. You don't stress out there, and if there is some kind of mishap, like they can't ID you properly, they can't match the documents properly, then they can do it early and you don't have any problem at your test day. So I advise that arrive at least 7:30 or 8 o'clock at the test day center so that the check-in process goes in smoothly, because these things are not gonna directly impact your test, but indirectly they're gonna play a domino effect on your test and ultimately gonna have some kind of drastic effect on the test. And bring the required documents. Now the required documents are going to depend on what documents you choose to be labeled as ID documents. If you choose your ID document as a passport, then you have to bring your passport. But if you choose your ID document as your ID card, national identity card, then you have to bring that ID card. It depends upon what you choose. All right. And the next is stay calm and focused from the the time you enter the test center and the time you get out after the speaking session. Stay calm and focused. You don't need to listen to anybody. You don't need to listen how the test is going, someone else's test is going. You just only need to focus on yourself. And after every session or after every section, you need to remind yourself that you are doing yourself. You're doing your best and you're doing great. And there is nothing more you can do. And things are going to go out pretty well. And before another tip of mine is that before going into the test in the test day, familiarize yourself with the test format at the morning of the test day, so you can have like how the test is going to start and what kind of questions are going to come in the test. All right, so the next are the don'ts. Many people do is they skip their breakfast. So the don't for me is don't skip your breakfast, because on the test day when you're gonna reach at the test center, the check-in process is gonna be continuous from 8 o'clock to 9 o'clock, and after 9 o'clock you're gonna be dumped down into a ride that gonna be continue till 12:30 or 12 p.m. And during that time you're not allowed to eat or drink anything. All right, unless there are some special categories, like if you have any kind of disease that prohibits you from not eating, then you will be advised, then you will be allowed to bring edibles, but they are only allowed in transparent bottles, or fruits, some things, small things, not large things like paratha or anda, the small things. And so don't skip your breakfast, because it's going to be a long ride, and by the time there's going to be 12:30, you're going to be exhausted and you're going to be running low on sugar. So don't do that, because there's still going to be a large playground ahead of you, that is speaking session. And if you are going to be low on sugar before that, that's not going to play well on your part. The next thing is, don't bring prohibited items to the test center, like foods, drinks, or electronic devices, because they're just gonna add unnecessary fuss, or go put it there, put it to your, give it to your friends, give it to your relative. They're not allowed in the exam center, because some exam centers don't even have a locker to put these things. So be careful about that. Don't bring unless they are necessary, absolutely necessary. Another tip of mine is that don't talk to the candidates, especially during the test. Maintain your silence. Whatever you want to say, whatever you want to ask the preparator directly. They are very good people. They are professionals. Whatever, whichever people they are professionals, and they don't say that, why are you asking me again and again? Why are you just do your test? No, you can ask the silliest of silliest questions to them, and they're gonna answer those. So don't think that I'm gonna be stupid if I ask something. Speak and ask openly to the preparator, but don't talk to the candidates. All right, because if you talk to the candidates, they are gonna just write. The preparator is not gonna listen to why are you talking to them. They're just gonna write a misconduct on your paper, and the marks are gonna be deducted. So that can be bad for you. The last tip of mine is don't forget the required documents. All right, don't forget those. If some people forget, some people mention the passport as their ID document, but bring their ID card instead of that. So please bring the document that you mentioned as an ID card on your OET portal. All right, no need to bring other documents. Time management. Now, time management is one of the cornerstone, a major cornerstone of OET tests. So for me, the best the best tool to understand the time management was giving mock tests. You can also give mock tests at the center, or you can give mock tests at your house. But a center, giving at the center has an advantage that you are gonna be time bound, and you're gonna play exactly as you are gonna play on the test day. But at home, the silly things are gonna come in. You're gonna, oh, I need to bring water. I need to bring this. I need to bring that. Then I'm gonna sit down, relax. So My advice to you is give 1 or 2 mock tests at a test center so that you become familiarized with the time management and you know that you need to complete a certain section at a specific time. So I advise you do mock tests at a test center, not at a house. But if you are comfortable doing giving at a house, you can also go for that. So, and while doing tests, candidates should focus on completing each section in a given time. You should not overlap the section's time when you are giving tests, especially at home. You should keep in mind that I need to keep this test going at a specific speed, and I'm gonna finish this section in this time and this section in this time, and this way you're gonna be prepared for the time management at that uh, in that test. And another thing is a writing section. The writing section is gonna have plenty of time. You're gonna have 45 minutes, and in which 5 minutes are gonna be for reading first, and after that 40 minutes are gonna be given for you to write, and it's plenty of time. The so you need to just relax, slow down, and look at the notes, prepare the notes, and then start writing. You don't need to rush in the writing part. What people do is they rush in the writing part, and in the end they're just sitting, and then they look at the notes and say, oh, I needed to write this, I needed to write this point. No, 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 they start rubbing and rubbing, and they dirty their paper, etc. So you need to, in the writing section you're gonna have 45 minutes, there's gonna be plenty. All right. Coming to the reading section is one of the easiest section, especially for doctors. So you don't need to panic in those section as well. And the last one is speaking section. Speaking sections are the sections that require practice. Reading you can do yourself, speaking you can do yourself, writing you can do yourself, but speaking it needs a partner that's gonna help you navigate through the session, avoiding unnecessary delays, clarifying your tone, clarifying your points. So next comes the exam format. The exam is going to consist of 4 subtests: the listening, reading, writing, and speaking. Okay. So the listening consists of part A and part B and C, and it's gonna be a single run test. You're gonna be given a booklet, and part A, B, and C are gonna be mentioned of them, and the single tape is gonna run for the whole test. And you, while the tape is running, you're gonna be answering the questions while listening to the tapes. All right, and it's gonna be 50 minutes, but it can also be about 40 to 42 minutes as well. Depends on the tape. And the next is the reading part. The reading part consists of 3 parts, part A, B, and C, and a total of 60 minutes. The part A is a short test. You're going to be given advertisements of patient information. It's going to be 4 paragraphs. Part A, paragraph A, B, C, and D, and they're going to give 20 questions for those 4 paragraphs, and you're gonna be looking at those paragraphs, finding the answer, and writing in those questions. They're gonna be much like an MCQ session. There no need to do a special type of preparation for that. You just need to do the mock test, especially the drive that Dr. Osama mentioned before. I also did that drive, and that was more than enough for me. Part B is gonna be longer text, like six text, and they're also going to be MCQ type text. And once you done with part B, part C is going to be 2 talks. They're going to be either some kind of long topic or some kind of long research, or any case study. It can be anything. And they're going to be 2 talks, and for each of the talks, there are going to be 8 questions, what are you going to do? You're going to look at the paragraph and then come back to solve the MCQ. Writing, as I told you before, it's going to be 45 minutes. 5 minutes are going to be allocated for you to read the notes, and 40 minutes are going to be allocated for you to write the letter. So it's plenty of time, and you just need to practice in these sessions. And next comes the speaking session. It's going to be approximately 15 to 20 minutes with 5 minutes of each role play. That you're going to play 2 back-to-back role plays. So let's come to the reading part. The reading part, as I mentioned before, is gonna consist of 3 parts: Part A, B, and C. The Part A is gonna be consisting of 2 booklets. One booklet is gonna contain 4 paragraphs: A, B, and C, A, B, C, and D, and the second booklet is gonna contain 20 questions. And after the part A is completed, it's going to be about 15 minutes, and they're going to collect the 2 booklets that contain the paragraphs and the 20 questions. And after that, you will be given the 2 booklets for part B and C. No, there's going to be a single booklet for part B and C. Part B is going to contain 6 questions. They're going to be long questions and multiple choice questions. So they are mostly easy question. As I told you before, that reading is the most easiest part for doctors. They just need practice. They need to practice a lot, and you're gonna be easy in this part. And part C is gonna be 2 talks, either researches, case studies, or any topic, and they're gonna be 8 questions for each talk. And the total combined time for these parts are going to be part B and C is going to be 45 minutes. Now, one of my tips for reading part B and C is to not focus on attempting as many as questions, is on attempting on as many as right question, is on going for accuracy, not for numbers. Because if there are 16 questions you are going to looking after time and saying, I know I'm going to do all the questions. You do 16 questions and there are only 7 or 6 questions correct. That is not good. You should aim for accuracy and should go for as much as right as possible. Focus on doing right rather than doing the numbers. This is the part A, reading part A. Like this is the paragraph, yeah, like pediatric gastric tube, its uses and issues associated with it. And there are gonna be these questions associated with it, and you're gonna write on the paper like what type of tube should be used for the patient for an extended period of time. It's gonna be written in the paragraph, you're gonna find the paragraph, and then you're gonna write in front of this line. So next comes the writing part. The writing part is is a total of 45 minutes, in which 5 minutes are going to be given for reading, and the next 40 minutes are you are going to be writing. That is for the writing task. So, and the writing task most commonly given to doctors are referrals or transfers or discharge. All right. Now, the most letters that are going to be given to you are going to follow this format, the S bar. You're going to first write the situation, and then write the patient background. Then you're going to write the patient assessment, and then you're going to write the patient recommendation. Only urgent emergency situation is that you're going to write A before B. It's going to become SABR. Otherwise, in every letter format, you're going to write is S bar. Now, this is a simple writing task. Like this, you're going to be given social background, family history, medical history, patient date of birth, etc., and a little bit of discussion about his visits, examination, etc. And at the end of the writing task, you're going to be given the task. So, using the information case and write a letter of referral to Dr. Smith. All right, and this is a sample letter. Now, let me tell you that till this to this and these, they don't have any number. Although they are important for you as a format, they are absolutely necessary, but they have no number. The numbers game is in this body. So I recommend you applying the S bar for every kind of situation letter, and in case of emergency or urgent letter, go for the SABR technique. Thank you so much.
Thank you. Thank you so much, Dr. Zain, for sharing your knowledge and experience with us. Next, we have Dr. Abdullah Munawar, a graduate of Ziauddin Medical College. He will be covering the listening and speaking parts of the OET exam. Over to you, Dr. Abdullah.
Okay, Assalamu alaikum. So my name is Abdullah, and again, I'm a graduate of Ziauddin University. I took my OET back in January, and currently I'm studying for my USMLE exams for step 2 specifically. So the topics given to me were stress management, listening, and speaking. So let us get into it. So stress management. So if I'm very honest, this really isn't the most stressful exam that we'll be taking. It's rather probably the easiest one. And any person with a decent vocabulary with decent grammar can easily clear the exam. So there's not much to stress about in this exam. So the advice would be like pretty much the general stuff. Be prepared. Obviously, if your preparation is good, you tend to be more confident. You're more likely to perform better. So obviously, prepare well for the exam. Get proper sleep the night before the exam. Have a good breakfast. Just take it easy. It should be fine. But sometimes things do happen. I thought I should share my own personal experience. So during my prep, I think I prepared for the exam for like 2 or 3 weeks. I was rather satisfied, I'd say, and I felt confident. So I thought I could just get it done in like 3 weeks. And as you can see, my grades for the remaining components, listening, reading, and speaking, they are pretty decent. But writing, unfortunately, was at the lower limit for the grade B. Even though, ironically, I was pretty confident with my writing. I had some experience research writing, and I was generally, satisfied with my prep. I even got one of my letters checked by a professional OET teacher, and they had like good remarks. But unfortunately, on the day of the exam, I think I made some error. Yeah, so it was with this resource that I was using. I found this document called 50 letters something. So what I did for writing was I basically wrote like 5 to 6 letters. And after that, I thought it was just more about getting acquainted with the format. So I would just read through the letters. And the funny part is, right on the day of my exam, when I was driving, when I was going to the center, was time I realized that some of the letters in that document, they weren't on the right format. I think they had used ChatGPT to write the letters for them and circulated them. So yeah. So the error I made basically was it was a referral letter, an elective referral letter, and I accidentally started writing emergency referral ka. So as Dr. Zan just said, the EBBAR criteria is supposed to describe the presenting complaint and everything, and then later on come to the signs and symptoms, your BP, your vitals, everything. So I started off with the vitals initially, and I realized that midway during the exam, and I had to erase the entire letter, and I had to like quickly redo it in like 10 minutes. I couldn't review it, and I couldn't finish it either. So I was just scared that I might just not even get 350. So like again, things happen, and as you know, speaking is your last component, and oftentimes you have to wait for 2-3 hours before you start with speaking. So those 3 hours were the longest 3 hours of my life. I kept beating myself up over this. But obviously, when the speaking component started, I didn't have the time to think about it. So you will, I hope you don't, but you might make some mistakes. Things might not go your way, but you have to just keep on going. That's the main thing. So let's move on. Coming to listening. Listening, I would say it's still a rather easier component. Part C might be a bit tricky for some people, but it's still not as tricky as the reading part C. So basically what happens is they give you, again, I just wanted to confirm, I am audible, right? Because I was having issues earlier.
Yes, you are audible.
Okay, perfect. So coming to listening, listening is basically a 40-minute exam, and you have 3 components, A, B, and C, with a total of 42 total questions. So if you want to get a 360, which is, I believe, the cutoff for the PLAB exam, MLE I think it's 300, but for PLAB, I believe it was either 350 or 360. So for that, you need to get 30 out of the 42 questions correct. That will be like a 70% of correct answers. That will get you a 360. So what happens is they basically give you headphones, you put them on, they do a sound check, just check if your headphones working fine or not, and then they play the audio. So the important thing to realize is once the audio is started, they cannot pause it and they won't replay it. So you have to be like very attentive throughout. If you miss something out, you cannot come back to it. So that's the important thing to note. So coming to part A. Part A, as you can see here, this is a screenshot of a sample paper, by the way. So you have like 12 questions, and how it works is you have like, I think 90 seconds to read the questions initially before they start playing the audio. You can quickly read through the questions and, just to get a gist of what you're supposed to look out for. And then they start playing the audio. It's basically a conversation between a physician and their patient. And as you can see here, they have left out some blanks here. They have given you a hint as to like what they're looking for, but they've left blank. So they're going to be playing the audio, and you're going to be careful, and you have to look for the specific points. So, for example, here they mentioned he had a back injury, which he sustained while lifting dash. So, you're looking for, you need to find out what exactly he was lifting. So, for example, the patient is going to say, I've been having a little backache ever since I lifted gym weight. So the answer is gym weight. So you quickly write down gym weight, and then you just, or like dumbbell, whatever, and then you just move on. So the thing is, you have to be quick. It's pretty easy, if I'm honest. Part A is very easy, and you're supposed to get like the high, get as many marks as you can here. But just be quick with it, and yeah, it's pretty simple. There were a few things which basically it's been a while since I took the exam, so I was quickly going through some resources, and I found a few things some of which I didn't even know during when I was taking the exam. So the first one is, this is from an E2 video, by the way. I've added the link so you can check it for yourself as well. So apparently there are no marks for spelling. So even if you make any spelling mistakes, which I'd rather not make, I'm still rather skeptic about this. But according to them, even if you make small spelling errors, they won't cut your marks, which is pretty big. But it has to be grammatically correct. So sometimes if you make a small mistake, for example, आपने tense mess up कर दिया, past tense, present tense, so it's going to be grammatically wrong. So you have to just make sure that your answer is grammatically correct. Thirdly, you can use common abbreviations. So for example, not rare वाले नहीं करने, the very common one, blood pressure का आपने CP लिख दिया. So that stuff is acceptable. And one more thing to note is they're going to be using synonyms. So for example, the message is going to be the same, but the wording they use in the audio and the wording they use here in the text, it's not necessarily going to be the same. So for example, here they've written, he sustained back injury, lifting dash. In the audio, they might just say, the patient might just say, I hurt my back while lifting this. So he said, I hurt my back, but here they've written back injury. So it's pretty much the same thing, and it's very easy to understand, obviously, but they might just, use different words. So that is part A. Again, it's a very easy component. Try to get full marks if you can, to be honest. And just be quick with it. If you do get stuck at some point, just don't pause and think about it. Just write the two options which you're confused between and move on. You can always come back to that option later. And yeah, so again, there's going to be two extracts, part A, fill in the blanks, part B, fill in the blanks, and now this is the end of your part A. Coming to part B. So part B, there's multiple different questions. So what happens is, in part A, it's going to be like a single long conversation that's going to be going on between two people. In part B, there are going to be shorter multiple audios. So you have like 25 to 30, I'm guessing that's like 6 MCQs. So there's going to be 6 different audios, each for a different MCQ. So how it goes is, they'll play an audio, and then you come, for example, for question 25, there's going to be an audio, you play it, you see the question here, pick the best option, and then you move on. Then they're going to play the second audio. They're going to give you a few seconds to mark your answer, and then you move on to the next question. So it's going to be that way. It's pretty simple as well. Coming to part C. So again, part C is comprised of 12 questions in total, and they're going to be divided into two. So basically, there's 2 audios for part C, and each audio has like 6 questions for each. So 6 questions for audio 1, 6 questions for audio 2, a total of 12 questions. So that's how it goes. These are questions 31 to 36 for extract 1. There's मैंने कहा पहला audio ये हो गया, and the second one I'm guessing is going to be 37 to 43 something. The remaining 6 questions. इसमें वही होगा, it's going to be a continuous conversation. You hear, you listen to the audio, you come to the question, and you choose the best option. So इसमें भी again, if you during the 90-second period that you get to read the questions, if you quickly go over the questions, you sort of have an idea what you're supposed to look for. So उसके बाद when you're listening to the audio, you'll be better able to pick, okay, आपके दिमाग में click कर जाएगा खुद ही कि ये चीज़ में I was looking for this thing, this said this, you come to the question, mark it, and then you move on. So this is part C. Again, listening is a rather easy component, and this shouldn't be a problem. These were a few resources that I came across. So yeah, I'll be sharing this PPT after I'm done, and maybe you could just go through them. Moving on, speaking. So I would say speaking is the easiest component of the exam. It's pretty much just a counseling spot. If you have, most of us are, I'm sure, already in our third year of med school, and usme hamara OSCE hota hai, so we always have a counseling spot. This is basically just a counseling spot. It's very simple. You don't have to use any complex English. Which is the best part about OET, I feel. I didn't take the IELTS exam, but usme I did go through it a bit shuru mein, but they expect you to have some good vocabulary, use complicated terminologies. OET mein aisa kuch bhi nahi. It's a simple everyday conversation that you're having. So speaking again is pretty simple. You can even prepare for it in like a few hours, to be honest. Prep mein the main thing I feel for speaking is practice. एक तो ये कि before the exams start speaking English. Like a lot of us, even myself, we don't really speak English इतना ज़्यादा. So it's better कि exam से कुछ दिन पहले you start conversing in English ताकि अगर there's some knots in your tongue वो खुल जाए. You get more comfortable speaking everything. Another thing to consider is इसमें आपके accent से कोई फर्क नहीं पड़ता. A lot of us don't have an accent. Indian accent है, ज़रूरी नहीं है कि आप अंग्रेज की तरह बोल रहे हैं. आप किसी भी तरह बोल सकते हैं, which is fine as long as you're audible, as long as you're understandable, it should be fine. So coming to the exam, you have a total of 20 minutes for 2 role plays. Again, counting spot, you have a total of 20 minutes. So before you start off with your exam, they're gonna give you 2-3 minutes of free speaking time. This period is not marked. इसमें ये होता है basically your आपका जो proctor है या जिनमें related है, the person you're conversing with, they're just gonna be like, let's just talk for 2-3 minutes, and because you were obviously a little tense at the time, you've been waiting, एक तो wait इतना ज़्यादा होता है for the speaking component. So they'll just ask you random questions. What's your name? Where do you work? Tell me about your job. Do you enjoy your job? How are your studies going? Random questions. Make the full use out of these 2-3 minutes. I was actually a bit anxious because again I messed up my writing, and speaking se pehle, your chest is heavy, everything. So just make full use of it. I started talking continuously. मैं बोला जाता ताकि I get in the flow and ताकि I get comfortable. So this is a very useful thing that they do. Okay. Now coming to 2 minutes of reading time. So they're going to give you a card which basically looks something like this. There's 2 cards. एक होता है आपका role player का या जो आपका invigilator है उनका card होता है, and then there's your card. So you have 2 minutes to go over this card. सही है? उस period में there's a couple things to consider. Reading time mein, one thing you can do is you can ask the invigilator, the person you're talking to, okay, what should I refer to you as? मतलब should I call you Miss Sandy? Should I call you the patient? वो खुद बताएंगे कि आप मुझे ये करके बात करें, which makes things easier for you. एक तो ये हो गया है. The second thing is, so with this card, like I said, it's a 5-minute role play. एक का सही है. So basically एक आपने role play कर लिया 5 minutes का, उसके बाद you have another one of 5 minutes. So 5 minutes में it's very important that you cover the entire 5 minutes. ऐसा ना हो कि आपका 2 मिनट में खत्म हो गया and the remaining 3 minutes आप बस वहाँ पे ऐसे बैठे हैं, या ऐसा भी ना हो कि आपने बहुत ज़्यादा लंबा कर दिया, 5 minutes होना था आप 7-8 minutes तक ले गए, वो भी आपका नेगेटिव में आएगा. So you need to fill in the entire 5 minutes. The good thing is you are given these pointers. They do tell you कि आपको क्या क्या बोलना है, but oftentimes अगर आप सिर्फ इसको follow करोगे तो you won't be able to finish the entire 5 minutes. So उसके लिए it's important to make up some points in your mind as well. For example, give some recommendations for exercises, advise importance of joining cardiac rehabilitation programs, etc., etc., etc. So इसमें ना basics से लिखा है. Then you could maybe think on your own कि इसमें मैं और क्या add कर सकता हूँ. For example, you could just add some irrelevant stuff, make up stuff. Recently, there's been a policy for like for the gym. ऐसा तो नहीं होता. So, for example, मैं अपने उसका बता देता हूँ. I had a case of lactose intolerance. उसमें ultrasound का कुछ भी नहीं लिखा था. But because I had to finish the 5 minutes, I was like, so we are mainly suspecting a case of lactose intolerance. However, if needed, we might have to go for a biopsy in case, because there are several other diagnoses that we could also consider, such as celiac disease or IBD, blah, blah, blah. So, apni taraf se, you can add some extra information to, fill in the entire 5 minutes. It could be somebody to, sorry? Hello? Okay. Okay, what was I saying? Yeah, so you can add some extra information. So yeah, one thing that somebody told me was that they don't really judge you on your medical knowledge as much. They're basically judging you on your speaking skills. Even though I did not want to risk it, somebody told me, okay, even if you make some medical errors, it should be fine. It's not a problem. They're not judging you on this. So that's that. Back to the slide. So उसके बाद अच्छा one more thing is जो starting sentence होते हैं ना, a lot of people, because they don't want to be confused, they just memorize the first starting sentence, which is usually like, hi, I'm Dr. Abdullah, I'll be looking after you today. So could you tell me a bit about what brought you here today? So अक्सर लोग वो होते हैं, the first sentence they just memorize it, first sentence, and the closing is usually like if do let me know if you have any further questions, etc. So there are certain things which you can just memorize. Also, 2 minutes. One more thing you can do is during the 2-minute prep period is I used to make like small notes. For example, इधर मुझे लगा I can add some information about ECG. तो यहाँ पे मैंने लिख दिया कि arrow लगा के ECG लिख दिया यहाँ पे कि यहाँ पे आऊँ तो मुझे ECG की बात करनी है and everything. So yeah, that's that. एक चीज होती है, as you can see in this card, find out the reason, reassure the patient, give recommendations, give time scale, provide recommendations. So these points, these are basically smaller tasks that they have given you. Find out, reassure, convey, explain, highlight. So specific to the task, आपको थोड़ा mention भी करना पड़ता है कि I'd like to reassure you. Very specific to them, you can use certain words. I cannot stress on this enough. I would like you to consider. Please do be informed. इस तरह की चीज़ है. एक तो ये है. फिर आपकी जो speech है उसमें there is a few more things. एक तो ये कि it has to be courteous. If any of you have been solving UWorld for step 1, you would realize कि कितना ज़्यादा these people focus on your etiquettes, your how courteous you are, how kind you are. Everything, please, thank you, इस तरह की चीज़ें आपको बोलनी है. And then 1 second. Allow me, would you please, I understand, you know, अपने empathy होनी चाहिए, non-judgmental everything, which we are coming to in a bit. There are also certain idioms जो आप use कर सकते हैं, sort of, as well as, deal with, in terms of, go through. So these are certain words that you are supposed to use in, you know, to get the extra edge. And let's move on. So this thing is basically they have 2 criteria. एक उनका linguistic criteria होता है, and एक उनका clinical criteria. I'm not going to go through the entire thing because it's going to take up a lot of time. But I'm just quickly going to go over the like the highest band, band 6, what they're looking for. So the pronunciation is easily understood, and prosodic features are effectively used. Accent has no effect on intelligibility. So again, like I said, accent na ho, if you have a very desi accent, that's nothing to worry about. As long as your pronunciation is clear, as long as your meaning is understood. Fluency, completely fluent speech at normal speed. Any hesitation is appropriate and not a sign of searching for words or structures. So again, you have to speak in a continuous flow, which you can develop by practice. I used to practice role plays with my friend. I think 4-5 cases kiए थे with my friend, and I started speaking more in English. इस तरह करके आपकी fluency develop होती है. And I feel the worst thing to happen in this situation would be कि आप बीच में अचानक से अटक गए. You're searching for words. आपका time ज़ाया हो रहा है. It leaves a bad impression and everything. Appropriateness of language. The entirety, appropriate registered tone, lexis for context. No difficulty in explaining technical matters in layman terms. So again, this is just a counseling spot that we have in our OSCE. इसमें कोई बहुत technical terms आपने use नहीं करनी. In fact, you have to make it simple for the patient to understand it. So उसमें obviously the more confidence you have with practice, you'll be better able to like translate these complex stuff into simpler everyday terms. So just make it easy for the patient to understand. And yeah, that's basically it. Resource of grammar and expression, rich, flexible, wide range of grammar, vocabulary, use accurately, confidence use of idioms. Again, idiomatic speech. मैंने actually idioms भी थोड़ा बहुत लिख दिया था कि जो note था उसमें लिख दिया था, as well as despite this, I regret to inform you, unfortunately, despite this everything. तो ये सब आप use कर सकते हैं. एक और चीज़ थी थोड़ी आपकी tone में. So basically, if you're breaking bad news, आपको अपनी आवाज़ थोड़ी धीमी करनी पड़ेगी, थोड़ी slowly, ताकि the patient is able to absorb it. If you're giving it like a general info, तो उसमें you can just speak casually, थोड़ा आपने तेजी से बोल लिया. Again, depending on the situation, you have to change your tone, आप कितना pause दे रहे हैं, everything. Basically, just again, so the one good resource about for this was E2 again. E2 के काफी सारे they have uploaded sample role plays. Actually, OET का अपना official एक page भी है, उस पर भी they have like samples. So go through some samples and then you have a better idea about how to go through it. Coming to the second, what do you say? Second clinical communication criteria. Isme there are 5 things. Indicators of relationship building. So you have initiating the interaction appropriately, demonstrating attentive, respectful attitude, adopting a non-judgmental approach, showing empathy or for feelings, predicament, emotional state. Isme, again, like I said, your first sentence hota hai, good morning. I hope you're doing well. I am Dr. Abdullah. I'll be looking after you today. Could you tell me a bit about what brought you here, or could you tell me about how you're feeling? उसके अलावा demonstrate an attentive, respectful attitude. Do not interrupt the person while they're speaking. बीच में वो they're explaining something और बीच में अपना सवाल पूछ लिया. That's a very negative thing to do. So do not क्या कहते हैं interrupt them. Rather listen to them attentively. और बीच में acknowledge their concerns as well. Like बीच में yes, okay, आपने थोड़ा बीच में बोलते भी रहे. Because the thing is they're going to be recording you. वहाँ पे छोटा सा tape recorder रखा होता है. They can't see you. तो जो भी expressions है you have to display them via your voice only. So just be careful of these things. B may have indicator of understanding and incorporating the patient's perspective, eliciting and exploring the patient's ideas, picking up the patient cues, relating explanations to elicit ideas. So इसमें, for example, आपने patient से initially पूछ लिया, could you please tell me a bit about what's been concerning you or what's been bothering you? And then the patient tells you, for example, he's been having some stomach ache, and he's going to tell you, I've been reading articles and I'm suspecting I might be having cancer. And then B3, they're relating the explanation to elicit ideas. So usme you just acknowledge, okay, so from what I've gathered, you seem to be having a little concern about your chances of having cancer. So you have acknowledged and you're able to link their words to their main concern. So that's what you're supposed to do. C may have providing structure, sequencing the interview purposely and logically, signposting, changing topic, using organizing technique and explanation. So make sure you go in a sequential order, make sure you go in a flow. It's usually is tarah hota hai, find out for the reason aapne bola, and then the patient looks at their card, they'll be like, they'll tell you, okay, you know, when you, जैसे आपने कोई सवाल किया, फिर अगला पॉइंट उनका होगा, it's going to be the reply to your question. So card इनको बोला गया, आप ये जवाब दें, and then you come back to you अपनी कंसर्न बताइए, then it tells you to reassure. फिर आपने reassure किया, फिर उसको बताया कि the next question उनको पहले ही बताया गया होगा कि जब डॉक्टर आपसे ये बोले, आपने ये बोलना है. So then you're gonna say this. In response, फिर आपको बताया आपने ये बोलना है, तो उसके बदले में उन्होंने ये बोला. So just make sure आप sync में चलें, make sure you go in the sequential order. And one thing they mentioned here was signposting. So signposting is basically आपका जैसे initially उन्होंने बोला गया था कि give recommendations for. You know, बोला give time scale for return. तो इसमें for example time posting में आपने बोल दिया कि आपने 3 suggestions दे दी हैं कि आपको ये exercise करनी है, you have to control your diet, blah blah blah. And then signposting में, and then you tell them कि now I'd like to give you an idea of regarding your follow-up schedule. आप थोड़ा सा just define it कि now I'd like to talk about this, now I'd like to talk about that. So you're basically controlling the conversation. So, yeah. Moving on. Information gathering, facilitating the patient's narrative with active listening techniques, minimizing interruption. Like I already said, बीच में आपने interrupt नहीं करना, yes, okay, I understand, ये सब आप करते रहे. Using initially open-ended questions and appropriately moving to close-ended questions. So आपने initially नहीं पूछ लिया कि आपको stomach ache हो रहा है. आपने initially पूछा, what brings you here or what's been troubling you, and then they'll tell you, I've been having some stomach ache. So yeah, उसके बाद you move on to close-ended questions, यानी you move on to the specific questions. Could you tell me about the nature of your pain? फिर ज़्यादा specific हो गया तो how long has it been going for? Is it constant or is it intermittent? इस तरह के सवाल. Do not use compound questions or, for example, do not ask एक साथ ही कि have you been experiencing chest pain? How has your breath been? दो चीज़ें एक साथ नहीं पूछी. पहले आपने पेन का पूछा, उसके बाद आपने chest breathing issue का पूछा separately. Leading questions being होते, this is pretty self-explanatory. You don't ask them, you haven't been smoking, have you? Yeah, तो फिर I'm sure you haven't been smoking. You ask them very open-ended उसमें कि have you been smoking? Do you smoke? उसकी मर्जी है. Leading question में basically adds a pressure to the patient कि the doctor is probably going to judge me if I say कि I have been smoking. Yeah, you know. So just open-ended questions again. Clarifying statements are which are vague and need amplification. For example, patient ने कुछ बताया and then you felt कि इतना clear message नहीं था. You can always ask them, could you please clarify one thing for me? इस तरह करके. सही है? To make sure the message is clear for you as well. Summarizing information to encourage correction. Basically, the patient told you everything, and then you आपने quickly summarize कर दिया. From what I've gathered, yeah, and the patient is going to acknowledge yes or no. Last now we're establishing initially what the patient already knows. Again, basically initial सवाल हमारे counseling में भी होता है. What do you call? Initially, what the patient already knows. So basically, what do you know about your condition? इस तरह की बातें हैं. What do you know about your condition? Could you tell me about what you've been told? इस तरह की चीजें. Pausing periodically, which when giving information, using the response to guide next steps. Okay, so basically, do not give them every information एक साथ. Do not bombard them with all the information. Take it slowly. Make sure they're able to understand what you're saying, and then move on. ये नहीं कि आपने एक साथ बहुत सारी information दी the patient, he's not able to understand it, and then you just continue the conversation. The point is to make sure that they're understanding what's been going on. So that's that. Again, encourage the patient to contribute reactions, feelings, pretty self-explanatory. Checking whether the patient has understood the information. So you can always ask them, I hope things are clear. Do you understand what I just told you? Discovering what further information the patient needs. So obviously, usually as in any OSCE spot, you always ask them, if you do have any further questions, please feel free to ask. So it's pretty simple. Again, some final tips that I noted down. Again, just speaking time hota hai, make the full use of it. It's actually a blessing they let you do it, so make sure you do that. Reading, try to read articles or books and try to read it मतलब silently नहीं, आप थोड़ी जोर से पढ़ें ताकि when you're reading it ना आपकी थोड़ी practice आ जाती है, आप थोड़ा flow में आ जाते हैं. तो try to read books before the exam, any articles, anything you like. तो आप that'll get you in the flow. Develop a habit of speaking English regularly, pretty self-explanatory. Oh, one more thing was this friend of mine told me. So basically, like I told you, the timing is very important. You have to cover the entire 5 minutes. So usme the छोटा सा timer होता है is usually kept facing the the proctor. So you can always ask them to shift it towards you ताकि you can keep a check on the time and make sure you're going at the correct pace. So yeah, these were a few useful links that I found. I will be sharing them with you. And thank you so much.
Thank you so much, Dr. Abdullah. That was super insightful. We now open the floor to a brief Q&A session. We have received questions from the audience and we would go over them one by one. So the first question is, what is the time duration to pass on OET? This one's from Dr. Osama.
Right. Can you further clarify in what context are they asking? What's the time? What's the ideal time to give the OET exam? Yeah. How long do you take to get your results back? Kis context mein ye sawal?
Okay, so I'm not sure कि किस context में है because this is the whole statement. I think it basically is what is the time duration to pass OET.
So the thing with OET exams is that somebody has their hand raised, so maybe it's the person who asked this question.
That question was mine. It was asked in the contest what's the total duration should be for the OET exam.
Okay, ठीक है. So if you're referring to the duration the test lasts, so that's 3 hours for the reading, listening and writing test, and then आप पे depend करता है 3-4 घंटे का usually wait time आ जाता है before you're speaking. And if you're referring to the exam itself, तो उसका जो results हैं they stay valid for 2 years, ठीक है? तो just like IELTS and OET, तो OET की भी इसी तरह they stay valid for 2 years. लेकिन I think the ideal time would be to give it somewhere between your step 1 and step 2 ताकि आप जब step 2 की तैयारी में देते हो so that at least it gets off your mind ये मैंने एक चीज़ करनी है एंड काफ़ी लोगों के साथ ये भी होता है कि पीपल नीड टू गिव सेकेंड अटेम्प्ट भी ठीक है. सम पीपल कहते हैं स्कोर्स रीचेक एंड काफ़ी दफ़ा ये होता है कि स्कोर रीचेक करो अगर किसी एक आध कॉम्पोनेंट में आपके यूर बिलो द पार तो दे फिक्स योर स्कोर और यूजली आपका स्कोर कम्स बैक इनटू द एक्सेप्टेबल रेंज. सो आई वुड सजेस्ट कि लाइक आई गेव माइन जिस तरह इन अप्रैल. So I think we're around, the year you tend to apply for the match, आप बेशक उससे कुछ अर्सा पहले दे दो, maybe in the preceding spring, ताकि it's off the mind आपका जब, you can focus on your step two उसके बाद. A lot of people gave it after their step two, लेकिन फिर they're always, concerned कि, अभी score नहीं आया, फिर हमारी ECFMG certification pending पड़ी हुई है, इस पे pathways नहीं approve हो रहे. तो I would suggest कि, somewhere between March, April, May, that's a good time.
Right. So the next question is, what is better, written or on computer OET test?
Okay, I personally preferred the written test because I was just more comfortable. क्योंकि इसमें ये होता है कि once the notes, the summary they give you, you can just tick things, you can cross out lines which you feel are unnecessary and you don't want to incorporate into your final draft. And I'm just more comfortable writing with a paper pencil. So I personally chose the paper version. Like, and a lot of my colleagues did the computer work. Computer में ये फायदा होता है कि you get an idea of your word count. So if अगर आपको लगता है कि your handwriting is messy या you tend to make a lot of mistakes or you need to rewrite a lot of sentences, I would suggest कि go for the go for the computer exam.
All right, and the third question is, what is better, IELTS, TOEFL, or OET?
Okay, so it's like comparing apples to oranges, like this question, because each is for a specific purpose. अगर आपने you need to apply to the UK, तो उसमें ये होगा you need to give if you're going for PLAB, ठीक है, you will need to give IELTS academic. उसमें you can also do the OET there. TOEFL का ये है, TOEFL is more geared towards US selected में जो universities demand कि आपका TOEFL हुआ वो, लेकिन they accept अगर आपने SAT 1 दिया हुआ तो they'll usually accept SAT 1 in lieu of TOEFL score. Other than that, अगर आपका some people are just more comfortable with IELTS. अगर किसी ने UK के visa के लिए they've already given IELTS general before, so they might be more comfortable with giving IELTS academic in that sense. Lekin, personally speaking, from what I've seen, US के लिए तो it's mandatory. US के लिए you don't have an option between OET and any other exam. You need to give OET. So I would suggest if you are confused between US and UK at this point, eventually आप decide भी कर लोगे, लेकिन eventually as you move into your fourth year, final year, या जब आप steps देने लगो या plan देने लगो, give OET क्योंकि you can't go wrong with OET. And then the thing is, it's more geared to us as medical professionals, so it's relatively easier for us. It comes naturally to us. And I've also seen कि जिन लोगों का like I know this is like an off the record बात, but जिन लोगों का IELTS पास जाता है वो OET निकाल जाते हैं. So that's my recommendation कि go for OET. Don't worry about that.
Right. And what are the minimum resources for OET?
Okay, minimum resources. Minimum resources, I would say going through the 4 practice tests that are on the website, that's an absolute must. Because if you don't do it, you will find yourself way underprepared. It's not like you will learn anything new in those 4 practice tests, but you will understand what the exam is asking for. Because yeah, it's more because it's not a knowledge-based exam. It's something you just have to answer the way they're looking for. Each one of you here is capable enough to do it. It's not something आप पढ़ के जाओगे तो आएगा. जो भी उस दिन आएगा, you right now, even if you go attempt it, I'm sure you all do great. लेकिन आप वो 4 tests करो and then figure out what area you're weak in. If you're weak in listening, just spend a little more time on the listening. Go to the resources जो driving मैंने share किया था उसमें देखो. And I think it was the 50 essays. I think I missed that movie. That was also mentioned by our speaker. So he's absolutely right. उसमें कुछ letters हैं which are wrong. So don't try to whichever resource you use, I would say try to understand कि वो कहना क्या चाह रहे हैं. And once you have been through a number of resources, you'll quickly realize कि there are a lot of resources out there which are fishing on people and they're not actually worth the time or the money. अगर पैसे तो लगाएं मत, मैं तो नहीं कहूँगा, don't buy any subscription या कुछ भी इस तरह की. You are better off saving that money for something else. Go through the practice tests, go through the YouTube videos, go through those 50 essays, like he said, कि आप, just casually read through them, and then you'll also, once you start picking out the mistakes in those essays, I think that's the point where you can be comfortable, कि you know what the exam is looking for, and you can be confident to go and give the exam for the writing. Listening or reading में भी कोई मसला नहीं, speaking में भी, if you just practice a few times with your friends, it should be good enough.
Right. Thank you so much, Dr. Osama. So, Dr. Zain, we have a few questions from you as well, for you as well. So, when to do OET if you're a medical student?
The best time to give OET is in your final year period before starting the house job period. This is the best period to give OET.
All right. And what is the cost of OET?
The OET costs around, I guess, it's 567 Australian dollars, and it converts into 1,25,000 rupees, Pakistani rupees.
Right. And another question is, should we do OET before step 2 or after?
Well, it depends on you, entirely on you, that how much you are capable of doing the OET. Well, my personal choice would be before doing step 2, because as one of my colleague, Dr. Osama, mentioned that it would be better if we give OET before step 2, because if we want to give an attempt after step 2 as well, then we have that choice. We don't waste our time giving attempts in the OET.
Right. Thank you so much, Dr. Zain. Dr. Abdullah, there are a few questions from you now. What are common mistakes people do in OET?
So the common mistakes, I would say, as I believe Dr. Osama said, be very wise with the resources that you use. Some people tend to unnecessarily, take a little extra time for the exam. There's this friend of mine who took I think 5 months just to study for the OET, even though I felt his skill set was good enough to get it done in a month or two. So just don't put in a lot of time, unnecessarily. Use the right resources. For example, the mistake that I made, I went through that document. So use the right resources. Again, so with the subscriptions and all, I didn't do any of those, but some people might genuinely have issues or might just need a little extra help. So those things might just work for them. And again, as Dr. Sama said, the main thing is going through practice tests. Go through the practice tests. Only that will help you gauge where you stand. And usi ke hisab se then you can book the date. Do not book the date agar aapki prep nahi hai, which usually hota nahi hai. Like you said, it's pretty simple and most of us will inshallah be able to do it easily. So these are the few things to consider, I feel.
Right. And what do you feel about OET preparation academies, OET Hub, etc.?
So I can't really comment on any specific academy, but there were quite a few friends of mine. Unfortunately, they couldn't clear the exam in a couple attempts. I think second or third time jaake unka hua tha. So I wouldn't I'm not experienced enough to comment on these things, but I'm certain there are people who do need a little extra help with these things, and for them it is appropriate to go to these academies. Even with the letters, so a lot of people, they tend to get some of their letters checked, even though aksar koi as such koi problem nahi hota, as such koi need bhi nahi hota, but I don't know, maybe just for the confidence, they do get their letters checked by some professional. So that all depends on you. I feel that you yourself can judge how good your English is. And as Dr. Sama said, this is the good thing about OET is it's very specific to our field. Compared to IELTS, IELTS is pretty much you have to write general essays. Yahan pe it's more about your medical sort of knowledge. I took my OET in the middle of my house job. Us daran mein we were sort of making these referral letters, we were making discharge summaries quite often. So उससे मुझे already थोड़ा सा idea था कि how to go about the letter and everything. So yeah, you can judge कि आपकी किस तरह है. Just take the exam practice test. आप देखिए किस तरह स्कोर आ रहा है. Try to work on your weaker areas. आप खुद पहले करेक्ट करने की कोशिश करें. अगर नहीं हो रहा, then you can maybe try to get a little extra help.
Right. And the last question is time management an issue?
So I would say it shouldn't be an issue if your practice is enough. If you've done enough practice, if you're well, the main thing is about this exam is that you have to be well acquainted with the format of the exam. So मेरे साथ actually हुआ था ये during my reading exam, reading part C. So reading part C again, it's basically two very long passages or comprehensions. उसके बाद you come to the question. Even though I had done like practiced it quite a bit, उसमें actually personally I felt कि reading वाले में इतने short period में I think I was getting decent scores, but regardless I felt कि I don't know how one can improve इतना majorly in a short period. But उसमें again the main thing was test taking strategy. That is the main thing about this exam. So one mistake I sort of made during the exam was I think we had 45 minutes in the reading component to complete two passages. तो उसमें होता ये है कि the questions they ask you, they are in sequential order. The first question is going to be from the first paragraph. The second question is going to be either from the first or the second, or the third is going to be from the third paragraph. So with the first passage, एक तो आपको करना भी थोड़ा meticulously होता है because part C के questions I felt they were a bit confusing. मतलब you do get stuck between two options. So for the first paragraph, what I did was मैंने पूरा passage पढ़ा and then I came to the questions. अब हुआ ये एंड में तो मैं पूरा भूल भी गया था कि पूरा पैसेज ऑब्वियसली याद तो नहीं रहेगा आपको, तो उसके लिए फिर मुझे इंडिविजुअली पूरा क्वेश्चन पढ़ा, फिर आई हैड टू गो बैक टू द पैसेज अगेन, फाइंड द आंसर, मार्क द आंसर एंड देन मूव ऑन टू द सेकंड के लिए दोबारा से पूरा पैसेज पढ़ना पड़ गया था. आई थिंक 45 मिनट्स में से आई थिंक आई स्पेंड अ मेजॉरिटी ऑफ द टाइम ऑन माय फर्स्ट पैसेज ओनली. सेकंड वाले में आई रियलाइज कि आई कांट डू दिस, तो उसमें फिर मैंने ये किया था, आई वेंट थ्रू द क्वेश्चंस फर्स्ट एंड देन आई मूव टू द पैसेज. I found the answer, mark किया, उसके बाद I went to the question again, फिर I come to the second paragraph again because it's in sequential order. So it's all about practice and test taking strategy and this basically just understanding how to go about the exam. उसके अलावा तो I don't think timing का as such कोई issue होना चाहिए.
Right. Thank you so much.
Okay.
Okay, so as we wrap up, I'd like to express our deepest gratitude to our distinguished speakers, Dr. Osama Ahmed, MD, Dr. Zainul Abidin, and Dr. Abdullah Munawwar for sharing their expertise with us today. Your contributions are greatly appreciated. Before we conclude, I'd like to announce that we are scheduled for a session on United States clinical experience on the 12th of October, so don't miss out on that. I'd also like to invite you to follow Ravish on Instagram at RavishNGO for updates on our free USMLE Webinar Series and other social initiatives. Thank you all for joining us today. Your participation made this event a success, and we hope you now have a greater clarity on OET. Have a great day ahead. Allah Hafiz.
Allah Hafiz, everyone.